Hi, I'm Karim Rizkallah. I'm a consultant anaesthetist in East Kent Hospitals Trust, and I do work in the One Ashford Hospital as well. To explain it better, I'll start by explaining what is anaesthesia. Anaesthesia means loss of sensation, and that is the main role of an anaesthetist. Whether to achieve that through general anaesthesia, where you go to sleep, lose consciousness, and that would, as explained, general means the whole body is out of sensation. Whereas regional is more focused on the area where the operation is being performed. So that region can be separately being put to sleep while the rest of the body and the brain, of course, is in full function. And that is achieved easier in areas where the operation is at the peripheries, such as the limbs or breast surgeries, where we can numb the area in concern and the rest of the body is functioning to its maximum capacity. No, it's not. It's been going on for a while now. And it's been definitely improving in terms of the areas that we have studied, that we can find, that we can block appropriately. More and more advances has come up to the safety as well as the performance of regional anaesthesia. So monitoring and efficacy of where we deposit the local anaesthetics and preservation of the nerve function and seeing exactly where that local anaesthetic and the needle is, deemed it much better and safer than in the old days. The patient is avoiding to having to be put to sleep, which has its own side effects, all the drowsiness afterwards, lacking of cognitive function, feeling sick after an operation, having a tube being put down the throat which carries local risks of sore throat, teeth damage risks. All that is being avoided when you have a regional anaesthesia. Also, the regional anaesthesia, apart from giving a pain relief during the procedure and anaesthesia, as we said earlier, it gives you a prolonged period of loss of pain, which is analgesia, that extends beyond the return of the sensation in the arm or the limb concerned. So the analgesia effect of regional is more than any other drugs can give you. Now we have more and more monitoring of while we're performing the procedure with ultrasound machine that we can see where the needle tip in relation to the nerves, the surrounding structures. So it is definitely safer to perform than it used to be. And our recent guidelines has been reinforcing the use of monitoring throughout the performing and the post-procedure when we do the blocks, so the patient is constantly being followed up for any complications or side effects. So definitely it is a safe option. So it's a patient choice, although sometimes we actually advise the patient, as anaesthetists, we advise the patient that they could go to sleep because the loud noises and the body moving operations such as hip replacement, knee replacement. Whereas in other operations, it is entirely up to the patient, and if the patient doesn't mind, we would encourage them to stay awake, as that reduces the requirements of any sedative, even if it is less affecting the general cognitive function and patient's recovery. It would be even better not to have any drugs that affects your cognitive function at all. So number one is no sedation, followed by that in terms of cognitive is the sedation, and then last, which is the least preferable, is to have a general anaesthetic with it. All I want to say is we understand that you are fearing the anaesthetic more than the surgery. It is very safe, and the anaesthetist is like the guardian angel on the day that makes sure that everything is safe, that you're well monitored and you're comfortable. So don't panic, and you're in safe hands.